So good morning. I want to welcome everyone here this morning. We're really honored to have Governor Tom Wolf join us today. I want to first start by thanking Governor Wolf for promoting vaccinations. Making a priority of your time and attention, Governor, validates our work as healthcare providers. We have been caring for patients with COVID for over a year now and continue to care for hospitalized patients every day. But we see reasons for hope, and that hope rests with vaccination. When you, Governor Wolf, elevate vaccination as one of your priorities, when you commit your time to promoting those vaccinations, it makes a difference in the fight, and we want to thank you very much for that. And we want to thank the Hospital Association and Andy Carter behind me for their guidance and support. We have a long association with HAP, and this year has been affirming of the value of that partnership. HAP is a reassuring partner, always there when we need help, and we're very grateful. I want to take this opportunity to thank our team here at Guthrie. Obviously, a special thanks to the vaccination staff at this center in Sayre, as well as all those who put together the programs to vaccinate our communities. To date, we've vaccinated about 40,000 people in the various communities around the area where we serve, including 4,100 of our own employees. This extraordinary effort is above and beyond their usual work, and we are grateful for their dedication and commitment. Most importantly, we want to thank the caregivers for the care that they provide to COVID patients, taking on the risks and strain of those difficult roles. The nurses, care partners, physicians, dietary workers, environmental services workers, and many others, their dedication is commendable. The past year calls to mind, for me, the opening paragraph of Dickinson's novel, Tale of Two Cities. It was the best of times, and it was the worst of times. That certainly describes the past year for me. Let me explain. Worst of times first. Simply put, too many people died. Too many people suffered. Watching an elderly grandmother in our hospital, in the ICU, on a ventilator, and likely dying was a tragic situation. And I want to especially, again, acknowledge those physicians and nurses, but especially our nurses, who served in many cases as surrogate families for people who were unable to have families near them. While it was certainly correct to restrict family attendance in hospitals, that put the burden on our nurses to serve as those surrogate families as patients, elderly parents, and family members went through their illness. It was an emotional toll that was significant. But it was also the best of times. Seeing the pure joy and the relief on the faces of those who got their first vaccination right behind us. I've received countless letters from those grandmothers telling me how grateful they are to be vaccinated, that they can now see and hold their grandchildren, and that they know they have not lost that opportunity, an opportunity that at some points in time they genuinely feared might never come. And no better example of the best of times was our COVID unit. Back in March, when we knew so little about this devastating virus, except that it was very lethal, we opened our first COVID-only care unit in the system. And every single person that worked in that unit volunteered. They chose to move from the safety of their current job to work in a unit where their safety was significantly at risk at a point in time when we knew so little about this virus. I want to thank the people that dedicated their ingenuity and creativity to helping us accommodate the physical needs of COVID. Negative pressure rooms, even whole hospital floors were created with negative pressure. We opened ante-rooms for donning and doffing. We converted whole floors in our ED, whole new flows. We opened testing centers, and of course, behind me is the best example of that flexibility. For those who don't know, we needed a warehouse in the beginning when we realized that the PPE supply was so short and our just-in-time inventory model didn't work. So we flipped this vacant space, which we purchased in April, into a highly functioning warehouse. And then in December, we almost overnight converted it to a vaccine center. The process for doing that involved new staff, training processes, deployment of technology, and a de novo scheduling system, the likes of which we had never done before. So it has been the best of times and the worst of times. We've relearned who we are and why we went into healthcare and medicine. We learned what we could do both individually and collectively. And now in the best of times, it calls on us to do one more thing, which we need to do quickly. We need to get everybody vaccinated. And we need everyone with any kind of influence to help us, from the governor, who has the ability to influence literally millions of individuals, to our local leaders, politicians, healthcare leaders, civic leaders who can influence our communities, right down to individuals who can lean on their friends, neighbors, and families to convince them to get a vaccine. The vaccines are safe. We vaccinated hundreds of millions of people with only rare side effects. The vaccines are effective, greater than 90% reduction in infections, and if you're in that small group who gets an infection, it converts a serious illness to a minor illness. So we have a treatment that offers prevention, reduces a lethal disease to an occasional minor disease, and prevents the risk of death. That's a pretty darn effective treatment. And lastly, it's available. We have it right here. There's an adequate supply of the vaccine. Our government has worked hard to make sure that all of us have the adequate supplies that we need to make this available to people, and the process of getting people vaccinated, of having it available physically, is there. So vaccination is our best path to get back to good health for all of us and a return to our normal life. So we're asking everyone to help us. Please get everyone vaccinated. I want to thank you again, and I'm going to turn it over to Governor Wolf for his remarks.
Thank you, Dr. Scopolidi, and thank you, Andy, for being here, and Mayor, County Commissioner, thank you for being here as well. I agree with you. This has been the best of times, but also the worst of times. The worst of times was what we've all gone through and the tough things that we've had to do and seen throughout this pandemic. The best of times are right over this curtain here. Talking to those folks, there's a look of hope and relief on the faces of the folks over there. And it's just a wonderful thing. We kept talking about the light at the end of the tunnel, and then we kept hoping it would come closer and closer, and I think we're here. We still have work to do. We still have people to get vaccines, but the supply is now where it should be. Everybody is eligible in Pennsylvania. I had my first dose on Monday. I didn't want to butt in line, and what I saw there is what I see over here, and that is people are full of hope. We're all happy that that light has actually arrived here. So again, I want to thank you, Dr. Scopolidi, for everything that you've done here in Guthrie, that everything Guthrie has done, and again, thanks for hosting all of us for this. But most of all, thank you for the hard work that you've all done. All of this space, all of the personal protective equipment that you see out here. It's just hard to remember that a year ago we were all scrambling to find this stuff, and now we have it in Harrisburg, you have it here, and that's really great. And the vaccine rollout is going well in Pennsylvania, and that's in large part to the hospitals, the healthcare systems, and the local vaccine providers who've made this dream a reality. You guys have been on the front lines of this war that we're going through. And you're on the front lines of the recovery as well, and that's really important. And Pennsylvania is doing a pretty good job. Now, I have my statistics are of yesterday, but we have 43.4%, over 40% of the Pennsylvania population has gotten at least one dose, and more than a quarter, 26.5% to be exact, have actually gotten the second dose as well. And we, for the most part, have been ranking in the top, like #1 out of the 10 most populous states in terms of first doses and second doses. It bounces around. I think we were tied for first yesterday, with California slightly behind them by a couple decimal points. But you know, Pennsylvania is doing really well. So the supply is there, but it really is up to the providers to make sure this gets out. So part of it is that we get the allocation, but the bigger part of this is that you know how to get this into the arms of people who really need it. And the faster we do that, that's the better for all of us. The more Pennsylvanians get vaccinated, the more they're going to feel safer, but the more safe we're all going to be as a result of that. These vaccines really are a game changer for Pennsylvania. I mean, we still have to be aware of the things that we've got to do to address this disease. I mean, like masks are still important, socially distancing, washing your hands, all that kind of stuff. If you feel sick, don't go to work. But getting vaccines really, really is a game changer. It really makes a big, big difference. It makes it safer for us to go out into the public. It makes it safer for everybody who comes into contact with us. That's important. And that's what's, as we want to get back to being with our friends and our family, and we want to go out, those are things that really matter. So once you're vaccinated, you can breathe a lot easier. And every time a Pennsylvanian gets another dose of the vaccine, again, that makes all of us safer. And we all of us, get a little bit closer to that normal that we want to get back to. So vaccination sites like this one make it easier for Pennsylvanians who live in rural areas to get the vaccine. And that's an important part of the goal of reaching our vaccine equity goal. We got to make sure that everybody, and Pennsylvania's a very diverse state, very big state, we got to make sure that everybody gets access to the vaccine. This vaccine site serves the entire region. In fact, it's really unique. In fact, you serve people from New York side of the border as well as from the Pennsylvania side. I'm not sure New York actually serves Pennsylvania is going to the other side of the border. So it's the kind of folks we are here in Pennsylvania. We're happy to do that. So it's really, really important. This is a crucial service, and I just want to thank you, want to thank the staff at Guthrie for doing everything that you've done to make this successful. And I want to thank all the Pennsylvanians. I just asked whether they're from New York side of the border, Pennsylvania side of the border, but I want to thank everybody who gets a vaccine right now, all Americans, especially Pennsylvanians. We're really contributing to that new life, that new normal that we want to all get back to. So if you haven't made an appointment, make one. Come in. There are openings, and we need you to come and get the vaccine. Get the first and second doses. It's going to protect you. It's going to protect your family. It's going to protect all of us. So thank you for doing what you're doing to get the vaccines, and thank you for doing what you're doing at Guthrie to make sure we have access to those vaccines. So now I'm going to turn this over to a great guy, Andy Carter, who is the president and CEO of the Hospital Association of Pennsylvania, which has been right at the center of dealing with this pandemic. So Andy.
Thank you, Governor Wolf. Thank you, Joe. It's a real honor to be here on behalf of the entire hospital community across Pennsylvania. We want to thank you all for the leadership you've shown through the Dickens novel, Best and Worst. And it has been an extraordinary opportunity for me as a representative of the hospital community to be a part of this journey and to be honored to serve alongside government leadership, such as Governor Wolf, as well as our member hospitals and the employees there. We see today what looks like a seamless operation. It looks perfect. But what we don't see is the fury of work that went in to get us to here today. It is phenomenal to hear the stories of the science and the logistics that led to where we are today, and it's very humbling. Now, since January 2020, Pennsylvania's over 240 hospitals and more than 300,000 individuals working there have been working together to prepare for and respond to COVID-19. They have spent the last 15 months selflessly treating everyone who came to them for care. And since the beginning of the vaccine rollout last December, Pennsylvania's hospitals have administered approximately 3 million doses across the state. It is part of the reason the partnership between the Wolf administration and the hospital community is so strong, because we joined the governor in this commitment, this profound commitment to getting the vaccination job done. And we are reaching these incredible milestones. Now that all Pennsylvanians 16 and over are eligible to get their vaccines, our hospitals across the Commonwealth will continue to play that central role. We'll be leading efforts to help answer the questions people have about the safety of the vaccine and its effectiveness. We'll continue setting up and staffing mass vaccine sites just like this. And we'll continue working with our partners in the community to spread the word about the safety and effectiveness of the vaccine. We know that people have trust concerns about the vaccine. And we're here today to just continue reminding all of us, listening to the scientists who have embraced the notion that these are safe and effective. We have to continue spreading the word. I got my vaccine recently, just like the governor, and one of the reasons was that I have a new grandchild my first grandchild, and I wanted to be able to spend time with her without being fully donned in PPE. And I raced the first day I was eligible, thanks to the governor's leadership, to get that shot done. Now, COVID cases continue to rise. Not as bad as the last surge, but it's real. And in addition to, of course, as the governor and Joe have said, washing your hands, wearing the mask, and following social distance guidance are all so important. So I want to thank all of you here at Guthrie for your selfless efforts to move this forward. And again, Governor Wolf, I want to thank you for your leadership and continue looking forward to working with you as a partner in the months ahead. So back to you.
Thank you, Andy, and now all of us would be happy to take questions. Any questions? Yeah.
Are there certain metrics, for example, percentage of the state population that's fully vaccinated? Are there certain metrics you're looking at to determine when the state can allow businesses to fully reopen at 100% capacity?
As you know, we're reopening as we speak. I think the answer is no. There's not any. I don't have any fixed thing. Because we don't really know what the right goal is. I think the general idea is it's somewhere around 65 to 70% the population getting both doses. 2 weeks after that, you have herd immunity. But to the extent we have people willing to wear masks, practicing social distancing, and doing the things that can offset the disease, we can actually go faster on that. So I think we're all looking also at the other side, that these new variants, there's concern that maybe mutations could actually come along that could defeat the vaccine, be more virulent. So far we haven't seen that. But the real strategy is to get the vaccines. But I don't have any hard and fast thing. I think, as you know, we're opening up and we're pretty far along that path. But I don't have any metric, and I don't think the federal government does either. I think they, as you know, in early March said states that have gone the whole way to open might want to pause a little bit. You know, don't forget that masks are still important and social distancing is still important. Those kinds of things. So we're looking at a whole bunch of things. So there is no one statistic.
Thank you.
Mm-hmm. Yes.
Yeah, with vaccination rates like here in Bradford County at like 16%, it seems there's kind of a mistrust either in the government or the vaccine itself. So how do you plan to fix that mistrust and get people to get vaccines in the future?
Yeah, I think the hesitancy problem is a problem that's extends all around the state, and I think one of the things that when we first started, the issue was really supply. The demand was, and so we really weren't addressing the hesitancy. Now, as supply has increased, we need to do more in that regard, and we were talking about that. I think one of the things that we're looking at the state is as the network of providers expands, it gets into the hands of pediatricians, family physicians, and folks that you trust. I mean, I think the only way to overcome hesitancy, I mean, there's going to be a small group, I think, that just are no way, but a lot of the hesitancy is just people sort of sitting on the fence. And I think to those folks, the special relationships that they have with a pediatrician or a family doctor or a nurse or just another family member. So part of what we're trying to do is make sure that we're putting more and more, as we go through this, as the supply increases, as we move from really focusing on getting shots into arms as fast as possible to addressing more uniformly this hesitancy problem. And I think that a big part of that is the relationship. I think another big part is convenience. So I think the President's view of trying to make sure that everybody is within 5 miles of a vaccine provider is also something that's going to make a difference. And as we get more supply, we can start doing more things like that. So to the extent convenience is at the heart of that hesitancy, that's being addressed. To the extent that people need to see someone they trust suggest that they get the vaccine, we're working on that. So those are the things that we're doing. Yes?
Governor, to our east in Susquehanna County, there is still some of that issue of getting the vaccine to some of those more isolated and rural areas.
Right.
Are there any plans for mass vaccination sites to get, like you mentioned, those vaccines within 5 miles of people in those rural areas?
Yeah, unfortunately, mass vaccination sites typically force people to drive longer distances. So I think as I said, the next step is really to move beyond mass vaccination sites and try to get it into a more decentralized case. So that in the hands of pediatricians, in the hands of family physicians, in the hands of local pharmacies. Those are the kinds of things that actually get it out to areas that I think have so far not picked up the vaccine as much as some of the more densely populated areas.
There's a big push to get teachers vaccinated. A lot of daycare workers were left out of that. Where does the state stand on making sure that daycare workers are getting the vaccine?
The idea was that daycare workers would be part of that, so maybe you know something that I don't know. One or two, yeah.
That were not included in
Yeah, the idea was that everybody, including we worked with the federal pharmacy partners. They get their own allocation from the federal government that's separate and apart from what the state gets. And so they have their own, I guess, regime in terms of what they want to do. But we work with them to make sure that the child care providers were actually taken care of. We also made sure that in dealing with educators, it wasn't just teachers. It was teachers, school bus drivers, janitorial staff, cafeteria workers, and it wasn't just public school. It was private and public. And it was, pre-K all the way up to high school. So the goal was to get everybody in that. If there are people who haven't been taken care of, we want to do that. I know we got a call from a teacher who was in Budapest for the year saying, I didn't get my vaccine, what should I do? And so I'm sure there are people who haven't, but the hope was that we could get everybody. Yes?
Going back to the vaccine hesitancy, sorry, I'll wait for you to run over there. There's a lot of people that are not necessarily against getting the vaccine. They're just indifferent towards it because they either had
Yes.
COVID, so they have the antibodies, or they're young and healthy. For that group of people, do you worry at all that saying things like we still need to wear masks and social distance when we are fully vaccinated, do you worry that that might either dissuade or at least fail to encourage that group of indifferent people from getting vaccinated?
I don't think so. Part of the reason is because, mask wearing actually has. Let me give you an example. This year, I don't know how you had it up here, but the flu season technically goes from October to the end of February, and for most of Pennsylvania, we didn't have a flu season this year, and a lot of people suspect it's because there were a lot of people wearing masks, and that was a real concern among healthcare providers because we weren't sure that we were going to be having to deal with the COVID-19 pandemic as well as flu season, and it turned out we got some help in that regard. And so I think that the wearing of masks is probably something that more and more people will do, when they're out and about. I think that the issue there is sort of a casual, almost an indifference to vaccines. Part of that is because if you're young. Now, I'm an old man, but I remember when I was young, I was immortal, and you don't realize that actually you're not. So I think that's an issue, but I think there's also just an issue of convenience. We're going to do some things with colleges, and with we recognize that with the first dose, a lot of kids will have left college and be home. So we need to make sure that we're working. Maybe in part with the federal partners to make sure that those second doses are available too. So I'm not sure. It is an issue. The upsurge that we've experienced has been to a large extent, focused on the 16 to 24-year-olds. So we have some work to do there to sort of say, get the vaccine, continue wearing the masks. It's not. We still have work to do to fight this pandemic, this virus. Yes.
What is the difference between the demand here within the hospital system, and maybe this might be better for you, versus Wilkes-Barre? Are we at the position where the rest of the state, more populated states, are looking at more of there's more demand? There was more demand and lack of vaccine, and now we're at the point where we have vaccine and there's lack of getting it, versus where we are rurally now.
I'll let you talk about what's going on here. From a state point of view, and that's why, if you recall, we were thinking originally of saying, a lot of states were starting to open up right as soon as April came around. And we said, well, we might overwhelm ourselves, so let's do phase 1 or phase 1B, and then phase 1C, and then open it up on April 19th. We got to April, a week before April 19th, and we were already hearing from healthcare systems and others that there were open appointment slots, so that evidently by that point the supply was up to demand. Before that, the issue, as you point out, was where can I go? I mean, there's a waiting list here. We really need to move more quickly. So it's interesting how fast that's come. I'm not sure how are you doing here on that?
So if I could, I think my description of this would be it's a little bit like a slinky. So as we had waves, 1A, modified 1A, 1B, so that brought a bolus of patients that wanted the vaccine, and at the same time then the vaccine supply had to match that. And so that kind of slinky motion has continued, and I don't think it's very easy to go, well, there's 16% of the population or some number is vaccinated, because you have to take into account the denominators. It's only been a couple of weeks that we vaccinated healthy 40-year-olds. And so our experience, if we took rather a different way to look at it, if we took the first wave and said, okay, now that group has had a vaccine available to them for some months now. So we're anticipating we can report that there's somewhere between 50% and 2/3 of the population gets the vaccine in the first pass. The remainders don't get the vaccine for a variety of reasons. There's not one single reason. Some of it is convenience, travel, work. Some of it is they're young and they're female. They're worried about pregnancy-related issues. Some of it is they just don't like vaccines. So if you add 5% for convenience and 5% for transportation and 5% for pregnancy worries and vaccine allergies in the past, et cetera, yeah, it adds up to maybe it's 25 or 30%, but it's not one reason. And so the governor is correct that the next phase of this, and I would really want to encourage everyone, the next phase of it is much more personal. It's not mass vaccine centers. We've covered largely that crowd, and we're going to, in the next weeks, wrap it up. Now it's a much more personal, one-on-one, your doctor, your family, your school, maybe your employer, encouraging an individual to get vaccinated. And that's a pretty heavy lift, but that's what we have to do next.
Anybody else? Yes. Oh, sorry. You haven't. I'll come. You're next. Go ahead. Oh, okay. So you're up then. Ben, back to you. That was an easy question. I like that. No, over here. Right, the guy with the white shirt there.
You talk about the importance of kind of getting it to that personal level and getting to those smaller communities. I want to go back to Susquehanna County again, a specific hospital in Montrose, Pennsylvania, in Susquehanna County. They went a month without getting any new vaccine doses, and they said it was because of a stopgap that the state had told was going to happen for a month, a 4-week period, and they wouldn't get any new doses, and those doses would go toward a mass vaccination site in the county. There was no word of when that was going to happen, where that was going to be.
And I don't know. I know the hospital in Montrose. I don't know why that happened, but we'll get you information as to why that happened. It might have been an issue of just supply, so I just don't know. Okay. Well, listen, thank you very much, everybody. I appreciate your being here. And again, thank you for everything that you're doing here at Guthrie. I really appreciate that. So thanks, everybody. See ya.